Well, welcome and thanks for joining Tech Titans. We have an exciting agenda planned for the next hour. My name is Tara Vicario, and I'll be your host as we tackle the tough stuff today. A few housekeeping items if you haven't been on for the last couple minutes. We welcome questions throughout the webinar, and you can submit your questions via chat or questions. We'll answer as many as we can at the end of the webinar. There will also be a quick survey after the webinar, and we truly would appreciate your feedback. Also, this webinar is being recorded for future viewing. So what happens when you get three technology and services companies that specialize in health services together? Well, we talk about the challenges post-acute care agencies are facing. Let's face it, 2020 and now 2021 have been 2 long years full of endless challenges. And while all of these challenges we face together can't be solved in 1 hour, we've got some of the top ones to discuss today. So, who are these Titans and how can they help? You'll learn more as we each take turns sharing more about ourselves and our companies, but to sum it up, we will address the often dreaded term compliance. Compliance as it relates to patient care, documentation, and billing. Compliance as it touches the workforce and, most importantly, our caregivers through training. And compliance through federal, state, and local authorities who keep us on our toes in terms of payroll compliance. And of course, all of this is amplified by what has happened in 2020 regarding the pandemic we all just wish would end. So I'm going to turn it over to Kristen and Kim from CanTime to introduce their company and get us started by taking us to the world of EMR.
Thanks, Tara, and thank you so much for hosting this. We are honored to be here and excited to share. I've got more to talk about than just the sports fans out there, but CanTime is an enterprise software solution. We scale with you as you bring on new payers, lines of businesses. Basically, as you have to diversify for this industry, we're able to scale up with you. If it is a service that you're going to deliver that's in a patient's home, then it's likely that we've got a solution that's going to meet your needs within the post-acute care industry. If you're wondering what post-acute care means, look up here at the screen and you've got all the different lines of businesses really cover and what we're able to do to meet your needs. With all the regulatory items that are changing, the compliance, the rules, the regulations, the configuration needs, having a solution that is able to meet all of your needs in one area, that's our strong suit. That's our unfair advantage, and that's what we bring to the table. But, hey, enough about us, enough about our solution. I want to introduce you to somebody that is far more important. She is Kim Spence. She is our customer success division leader and one of our regulatory specialists here at CanTime. She has over 35 years of experience. She's a nurse, an RN, and more than 20 of those years are spent in the adult skilled setting. She's held various agency management positions along the way, and she's going to go over all of the different regulatory battle items that are on your hands, where to find the resources to stay up to speed with that, and then she's going to talk a little bit about how what solutions are out there to really be able to help you. So with that being said, Kim, I'm going to turn it over to your capable hands. Thank you so much, and here we go.
Thank you, Kristen. Well, so one of the greatest challenges, obviously, for any agency is keeping up with all the regulatory changes, especially now with the pandemic. There's been such frequent modifications in policy requirements, staff and client screening, PPE, when do I quarantine, what will the surveyor look for? And then there's the telehealth question. Can we use it? Should we use it? Will we get paid for it? What are the rules? There's all the waivers. Now the repayment on the advance payments. What do they apply to? How long will it last? How will it come about? And then we all had the huge, in adult school world, the huge changes in billing with the no-pay wraps that have to be sent in that 5-day window, the changes to what was required to bill the wrap, and this also applies to any Medicare secondary payers. There's new information now on the home infusion therapy services, sequestration, claims processing issues. How do you keep up with all of this information and all of these changes? These are some of the issues that we here at CanTime monitor to help keep our platform up to date and help your agency in the battle to maintain compliance. So today we're going to talk about some of these and the resources available to help you stay on top of all of the changes. So before I start on the content, on each one of these slides, there are hyperlinks to all the resources. And at the very end of the presentation, there is also a slide with all these resource links. So as far as emergency preparedness goes, on March 26, CMS issued updated guidance for surveyors related to emergency preparedness requirements. This included modifying the annual plan review could be updated now every 2 years instead of annually, except for long-term care, which is still yearly. They decreased the training requirement from annually to every 2 years. And for outpatient providers, they also decreased from twice annual testing exercises to only once annually. They also added updated guidance on best practices as related to any infectious diseases, obviously all prompted because of the coronavirus. So there are links here to that actual updated guidance that went out to the state survey directors. This is the actual PDF document that went out. And then there's also additional information from CMS on the emergency rule and several other things on that emergency preparedness rule page also. CMS also has resources related to COVID that can be found, again, at the link above. It has information on waivers, vaccine policies and guidance, telehealth, etc. Just lots and lots of good information and the most recent, hopefully, updates. You also want to be sure that you have access to the latest information, obviously, from the CDC, and the link for their resource page is shown here. Also know that NAC has a COVID resource page that's very, very extensive. In fact, it has links to many of the other things I've already shown you and additional ones here. I did log out and actually try to access this as a non-member, and everything that I tried to access from this COVID page was available to non-members, so just as an FYI. So now, besides COVID, there's also other updates, and how do you track those? Medicare providers specifically should be aware of the CMS page that enables you to access provider-specific information. So once you've accessed the site at the link above, then at the very bottom left of the page, there is an area that allows you to click on the provider type. In this particular one, it's the home health agency link in purple, but clicking on there takes you to lots and lots of specific information just to that type of provider. There we go. Something else I would also highly recommend for anyone that's a Medicare, Medicaid provider, go sign up for the email update. There's a link above that's shown. You put in an email address, and you go to a very extensive menu and select subscriptions, things you would like to subscribe to, and they will literally send you the updates as things are coming out to your email. You might even want to have more than one person in your agency monitoring different types of updates. It's also very important to be aware of any claims processing issues, which since the change over to the no-pay wraps, there have been quite a few. This map shows the current max. I've included information that I'll show you in a moment on some information you can see from Palmetto and CGS. I did attempt to include some from NGS, but it appeared you had to actually have a provider number and log in to see any information for that jurisdiction, so I wasn't able to include anything on NGS here. An example of the information that you can find, the information on the left came from the CGS site, and it spoke about Medicare systems correcting 3 errors affecting the payment of 2021 claims, that correction they did on April 1st regarding claims that were spanning 2020 to 2021 were paying 2020 rates in error. That was corrected. There were a couple of others that were regarding the RAT penalties not applying correctly. So just as you can see here, on like I said on the left, that's information that came from CGS. On the right is a screenshot of the Palmetto claims payment issues log, And again, there's a link for that. Those are either at the bottom left of this slide or again at the last slide of the presentation. And you're able to click into those, look at current details. What is the guidance? Is there anything additional you're supposed to do? So these are very, very good resources for your billing folks. So how do you win the battle in all this regulatory mess? You be proactive. It's very important to have memberships in your state and national associations. It's very frequently, they're not only going to give you up-to-date information quickly, but they're going to help get it interpreted, and they're also advocates for the industry. Attend conferences and webinars from industry experts, subscribe to email updates, as we talked about earlier. Designate someone in your office or maybe more than one person to monitor for those regulatory changes, and make sure you educate your employees. If you can start talking to them even a little ahead of time before the change comes, often it's easier to get compliant quickly. So I hope this information will help you in your agency in maintaining your regulatory compliance. We didn't have a lot of time to go into detail, but these are all excellent resources. And know that here at CanTime, we will continue to track regulatory changes to help our customers maintain compliance and patient care documentation and billing. And we also include regulatory updates as part of our monthly newsletter. So that will do it for my portion.
Thank you, Kristen and Kim, for your expertise. Lots to cover in a little time. Let's switch gears now and move into a challenge near and dear to everyone's hearts: training and caregiver development. James, the floor is yours.
Thank you, Tara, for the introduction. Again, my name is James Cohen. I'm the CEO and co-founder of Nevvon. We are an online compliance training platform for your caregivers. So, some quick notes about Nevvon. We have a native app for caregivers where we're finding that 91% of our caregivers are using the app versus learning over the web platform. We have strategic integrations with agency management softwares and payroll companies like Viventium. Nevvon's training is compliant in all 50 states. As EVV has become law this year, we have found a huge demand for EVV training, which we have, of course. Because of the pandemic, we are seeing more states permit hybrid training programs to get individuals trained to become professional caregivers. And lastly, we have a unique payment model where you only pay per usage. Myself, I'm an ex-provider, fully understand the issue of a huge turnover of caregivers in the industry. So we have a consumption payment model where you only pay for the training that actually occurs. I'll quickly speak about two trends we're seeing in the industry right now, being that we talk to agency owners across 28 different states every day. Number one, there's a clear trend in training requirements for caregivers that are going to be more strict and more enforced. We feel the reason is obvious: quality measures. We believe that better training equals better care, which of course equals better health outcomes. We're also seeing a huge adoption rate among caregivers in using their mobile phones for technology in a better way. I think why this is happening is because many software providers are building their software with their caregiver in mind, creating a better user experience and a better user interface for the caregiver, and of course creating software programs for them that are multilingual for those caregivers that English is not a first language. Today I'll speak about two key training programs. First, we'll be speaking about the EVV training program, and then we'll be talking about the hybrid training program. So New York State was one of the first states to enforce EVV training. On August 1st of this year, in New York State, all home care agencies, including caregivers and office workers, including consumer-directed programs, need to have all their employees trained by August 1st on an annual basis on EVV training. These are going to be the requirements for New York State, which are very similar in other states that are mandating it. So number one, the EVV systems overview and workflows, the non-technical part of it. 2, how to electronically collect EVV data using the provider system and devices. How to and when to collect EVV data manually and what to document. How to document live-in caregiver information, which obviously could be very tricky. How to electronically collect EVV data when there are multiple caregivers. How to collect electronically EVV data when there are multiple beneficiaries, so husband and wife team that you're caring for. How to send data to provider system, and what information to share with Medicaid beneficiaries and their families about EVV. That's where office staff would come into play for training. We've also seen some states permit agencies to create their own training programs to take individuals and train them to become formal caregivers through a hybrid training program of mostly online training and some in-class training for competencies. To give everyone a feel, these are the requirements, again, in New York State that are very similar in other states. So number one, all policies and procedures must address the following. How the students will be selected for hybrid training, their enrollment details, how the required documentation will be obtained. Number 2, the attendance, how will it be taken, the documentation maintained, how the trainee's identity will be verified for attendance. Really important that we don't want their children doing it or friends doing the training. We want to make sure that the identity is confirmed and the software has the ability to do that, and all the attendance requirements for the hybrid training. For number 3, the curriculum and learning materials. So again, how the curriculum will be presented online, if there are any textbooks and other learning resources, how they will be provided to trainees, what the required topics are they going to be taught in English or other languages, what the learning objectives are, and the time allotted for each module. Number 4, the tech platform. So when you apply for permission, the description for the platform from the online content or component is really important. What specific equipment is needed to access the training, and how the system will be tested prior to the training. Really important is how the trainees will access the online training, and how the nurse instructor as well will be trained on the use of the tech platform. For number 5, IT support. There always needs to be IT support when the hybrid training is happening, specifically to the online training, both for the nurse instructors who are leading the class and the trainees, to deal with issues like equipment, accessibility, or connectivity. We're going to address the confidentiality of the student information and the training and testing materials. Some states are requiring 7 years for it to be kept. Other states are requiring it for it to be kept for 6 years. For testing, how trainees will be scheduled and monitored for in-person testing. This portion is not permitted currently right now online. It has to be in person. And for the skills, how the trainees will be scheduled for in-person skills assessments, their SPTs, the supervised practical training, and how they'll be conducted. Finally, number 9, for program monitoring and evaluation, the description of the evaluation design and methodology that will be used to ensure continued quality of hybrid training. We are taking back feedback from both the nurse instructors and the trainees to understand how well we're doing and to identify the metrics behind the quality of training. And lastly, there are two other programs that are similar. You can take personal care aid upgrading to upgrade them to home health aides, and as well upgrade and transition home health aides into CNAs. So there are hybrid training programs for that as well. So that is it for me. If anyone else has any questions, of course, you can ask at the end of the webinar. Back to you, Tara.
Thanks, James. Your passion for training is contagious. So I will finally introduce you to Viventium and my favorite CPA, Malka Trump, who will not only tackle the world of what we call everyday compliance, but also the new provisions brought into existence by COVID-19. Viventium is a human capital management company that specializes in in-home care payroll and HR. We began in 1991 and have since onboarded over 5,000 clients. What differentiates us from other payroll companies is our ability to handle complicated payroll elements found in home care and home health industries. Our flexible software, dedicated health client service team, and our ability to integrate well with partners is why we pay over 235,000 employees in health services nationwide. Payroll and HR are two of the main elements within HCM, but as you know, there are many other products and features necessary to run the business day to day. We offer products that start at the very beginning of the employee lifecycle, from applicant tracking and onboarding, all the way through each payroll process and open enrollment for benefits each year. Our goals are simple: to make administrative functions faster and easier, to help protect the business from potential profit leaks by keeping the agency informed about compliance regulations, and finally, to give tools and options to caregivers so we aid in the journey to better caregiver retention. Speaking of compliance, Malka will take us through the major compliance categories we see every day and provide insight on the latest provisions that the pandemic has brought about.
Okay, thank you, Tara. My name is Malka Trump. A little bit about myself: I'm a CPA, ACPP, and the Director of Compliance here at Viventium. I've been with Viventium for over 11 years, and my role here is to stay on top of all the latest regulations and everything that's coming out there from the federal and state agencies to make sure that our software and our people and our clients are up to date and ready to handle anything that the federal and state government agencies send our way. So I'm excited to be here to talk to you today about some of the compliance challenges affecting all of us. There's a long list of items that we could discuss, but I'm going to take you through some of the big ones that we encounter on a regular basis. So compliance affects the home care industry in so many areas, including, of course, payroll compliance, which is our niche here at Viventium. And we find regulations on federal, state, and local levels, so it can get pretty complex. On the federal level, home care agencies deal with issues like FLSA overtime, which can get complicated when you have blended rates with employees working at different rates in the same work week, or retroactive pay, where employees might come back later and report some work time that was not recorded at the time it was actually earned. So you have to take into account what was worked back then and the overtime rates then. On the state level, many states have regulations like 7th-day overtime. So if an employee works 7 consecutive days, they have to be paid overtime on the 7th day. And there's also daily overtime laws, where if an employee works more than a certain number of hours in a given day, then you need to pay them overtime for those hours in excess of usually 8 hours in a day. Like California, we see that they have both 7th-day and daily overtime laws. And also on the state level, many states have spread of hour regulations, where agencies have to make sure that that extra hour, that spread hour, kicks in at the right time, is paid at the correct rate. On the local level, we have wage parity, compliance requirements, which vary by locality and are quite complex because you have to get into all the various pay and benefit requirements and what benefits are allowed to be included and how to calculate them on an hourly basis for each employee. So those are some highlights on the payroll compliance side. We also have the Affordable Care Act, which I'm sure many of you have to deal with. And one of the main areas where the Affordable Care Act comes in for home care agencies is making sure that you are on top of your employees' full-time status. Many employees, work varying hours. So you have to make sure that you are able to determine and track their hours, and you are offering health coverage to everyone that you are required to. And then HR, of course, always has its complications. There's always a slew of new forms coming out. As we saw back in 2020 at the beginning, the new W-4 came out, which impacted all employees and is still something that many employees and employers are grappling with today. Also on the HR side, we have our paid family and medical leave laws that are the latest trend in many states. We're just seeing many states continue to jump on the bandwagon and issue either paid family leave, paid medical leave, some combination of the two. And employers have to make sure that they stay on top of these requirements, like what they have to accrue and payouts and rollovers. So that can all get quite complex. So that's our everyday compliance. Moving into COVID-19. If everyday compliance wasn't enough, the COVID-19 pandemic introduced a slew of new compliance provisions, many of which were out there to help employers and agencies across the country. And they provided and continue to provide an essential lifeline to agencies struggling during the pandemic. If you recall, back in March of 2020, we saw our first major piece of COVID legislation, the Families First Coronavirus Response Act, FFCRA. And what that did is that it required certain employers to provide paid sick and family leave to employees who were out for a qualified COVID-19 related reason. But this paid leave was essentially financed by the federal government because employers were able to offset their federal tax liability with credits that equaled the paid leave. So really the government came in here and said, you have to pay these employees who are out on leave, but really we're gonna pay for it. Just funnel it through your payroll, either if you do it in-house or through your payroll provider, and offset your federal tax liability. And it actually is a refundable credit. So if there's any excess beyond the federal liability, those employers could receive those taxes back from the IRS. As we moved into 2021, under the Consolidated Appropriations Act, the paid leave moved from being a mandatory leave to a voluntary leave. So now employers can choose if they want to pay their employees who are out due to a COVID-19 reason, but if they choose to do so, they still get those payroll tax credits. So employers have that flexibility where they can go that extra mile for their employees, make sure they stayed paid, but it's not impacting them in a negative way because the federal government still provides for those tax credits. And then just about 5 weeks ago, under the American Rescue Plan Act, paid leave eligibility was expanded, so more employees became eligible for the leave. There's more qualifying reasons. And the leave itself was extended through the end of September 30th of this year. So again, allowing employers to continue to pay their employees on leave, claim tax credits, and essentially providing critical pay to Americans while not burdening employers who want to pay their employees who are on leave. Next one is a big one. We have another COVID-19 provision, the Employee Retention Credit, also known as the ERC or the ERTC. And this was originally created under the CARES Act, again, back in March of 2020. It's another payroll tax credit in which eligible employers can claim a percentage of their employees' wages as tax credits and reduce their federal tax liability, also a refundable credit. In 2020, that credit amount was actually up to $5,000 per employee per year. So for the entire 2020, potentially if an employer was eligible, they could claim $5,000 in credits per employee. As we moved into 2021, that credit, the employee retention credit, was both expanded and extended. It was supposed to end at the end of 2020, but under the Consolidated Appropriations Act, that credit was increased to $7,000 per employee per quarter. In addition, back in 2020, employers with under 100 employees could take that credit for all their employees, whether those employees were still working or not, or if they were not working, as long as you were paying them, you could claim that credit. As we moved into 2021, that threshold increased to 500 employees. So in 2020, if you had over 100 employees, the ERC might not have been so applicable to you because you could actually only take that credit if your employees were not working and you were still paying them, which might not have been so applicable to many agencies. In 2021, that threshold is now 500 employees. So if you have under 500 employees, you can take this credit if you meet the eligibility requirements for all employees, whether they're working or they're not working. So if ERC wasn't for you in 2020 and you haven't taken another look at it, it may pay to do so because you might be eligible now, and you also the credit might have a bigger impact for you right now. Under the Consolidated Appropriations Act, another change was that employers could take advantage of both the ERC and the Paycheck Protection Program, which we'll talk about shortly. Originally, under the CARES Act, the PPP and the ERC were mutually exclusive. You have to pick one or the other. That's no longer the case. And under the American Rescue Plan Act, the ERC, which was going to expire at the end of second quarter, was extended through the end of 2021. So that's potentially a credit of $7,000 per employee per quarter. So potentially thousands and even hundreds of thousands of dollars in tax credits for eligible employers. And finally, I just wanted to touch on the Paycheck Protection Program, aka the PPP. PPP was also introduced under the CARES Act. And what PPP is an SBA loan program in which eligible businesses can apply for and receive potentially forgivable loans to cover their payroll expenses. Again, the federal government wants to keep businesses afloat and employees paid. And PPP has been an essential lifeline to so many employers navigating the COVID-19 pandemic. As we moved through 2020, further PPP legislation was introduced. First came the Paycheck Protection Program Flexibility Act, which provided employers who were applying for loan forgiveness greater flexibility, simpler applications, made things more flexible and easier because those loan applications were really complex, and they still are, but there's some wiggle room and there is some more flexibility, and some businesses with smaller loans can fill out just simplified applications. Later, under the Consolidated Appropriations Act, more funding was poured into PPP. Funds had previously been drained, but what the Consolidated Appropriations Act is, it opened it up again, allowed for more applications, more funds are there, and provide an opportunity for more employers to obtain loans, and even in some cases, apply for a second loan. So as we said previously, this act also allowed for PPP loans to take advantage, PPP employers who had PPP loans to also take advantage of the employee retention credit. So those two can now go together. And just recently, under President Biden's PPP Extension Act of 2021, the due date to apply for a PPP loan was extended from March 31st to May 31st. So there is still time to apply for a PPP loan if you haven't done that yet, or if you think you might be eligible for a second loan, it's something you may want to look at. The opportunity is still there. So what does this all mean in 2021? Well, what it means is that we can all count on continuous change in the world of compliance. The new normal will probably mean the continuation of a lot of activity in Washington, D.C. and various state capitals. There has not been long periods of time in the past 12 months when there hasn't been some discussion on the federal or state level of some new piece of legislation to address the pandemic. So it means healthcare professionals are going to have to continue to be on top of this information. so they can take advantage of what they're eligible for. In tandem with that, the new normal is likely payroll is going to continue to be the government's preferred vehicle for industry stimulus payments, which means payroll is going to continue to be more complex, and it's important to have the software data and expert guidance you need to navigate that. Because being on top of all these regulatory changes will continue to be key, not only staying above the water, but being able to thrive in 2021. A key takeaway I would like all of you to leave with today, if nothing else, is to stay educated. Word of mouth is not enough. There's so much out there, and there's going to be more changes, and the best way to make sure you don't miss opportunities is to stay up to date and find that expert guidance you need. So attend webinars, read blogs, articles, keep yourself informed. In addition, technology it plays a major part in staying in compliance with all the ever-changing regulations out there. And it's important to have technology that's going to work with you and not against you. This includes software with automatic pay calculations that's going to keep you in compliance with all our regular compliance things that we see every day that we had discussed earlier, like overtime and daily overtime, 7th-day regulations. Other software tools that help you stay in compliance are things like geolocation, where if you set up employees, the software is going to automatically look at where the employee works and where they live and ensure that all their taxes are set up correctly. Because there's so many different jurisdictions out there, tax jurisdictions, and it can get complicated as you get into the locals. So having a software that does that for you, as well as the software that has rule-based and date-effective settings to ensure that everything kicks in at the correct time when you need it. And you'll also need reporting tools, especially when it comes to COVID-19. With the proper tools, you can track all data related to tax credits and other relief provisions. Everything you need to be able to fill out a PPP loan application is going to come through the reporting tools that you have. Viventium's COVID-19 dashboard is a great example of something that we've put into place in 2020, which gives employers details on all the COVID credits or deferrals that they've taken advantage of or can take advantage of, payroll by payroll, and even an employee by employee basis. People always need to make important financial decisions, but especially in times like this, and so that's where data is key. So real-time dashboards and KPIs are a great way to make your data meaningful and to help you analyze your employee and payroll data to determine what's out there, what you can take advantage of, what you might be missing. Okay, so with that, Tara, I am going to turn this back to you.
Thank you, Malka. So I'd really love to thank Kristen, Kim, James, and Malka for an hour or less of quality content. We hope you found this webinar helpful. As 3 specialized companies who know what it means to bring you best-in-breed solutions and stellar service, we're happy to answer some of those questions that came through during the webinar. So I'm going to start with Kristen and Kim. One question for you. Sometimes the state and federal rules are different. Do we have to try and follow both? How should that be handled?
Okay, well, this is Kim, and that does happen. I've seen that fairly frequently, but it's a fairly simple answer. If you have 2 differing regulations, you always follow the most stringent guideline. So if you have a situation, for example, where maybe you have Medicare saying you have 2 days to give a discharge notice, but your state says you must give 5 days, then you have to follow that 5-day rule. So if you go with the most stringent, if you have conflicting rules, then you will actually meet both guidelines.
Thanks, Kim. James, we have a question here. Are you finding that caregivers are using the mobile phone or computers to do their training?
Thank you, Tara. Great question. Yeah, historically we felt there was a lot of pushback from agencies that caregivers can adopt to new technologies and use their mobile phone. But over the years, how training has evolved and user experiences have been better, we're definitely finding a vast majority are using their phones over computers. And I think bottom line is, with the caregivers and their economic demographic, they're probably not sitting with the computers at home. They run their lives from their phones. So I think sometimes we don't give them enough credit how well they can use their mobile phones. And I mentioned earlier that in our company, we're finding 91% of the users are using the mobile phone to train, rather than only 9% are using the web platform or the computer.
Thanks, James. And Malka, can a company that received a PPP loan claim the ERC retroactively for 2020?
Yeah, so Tara, that's a great question, and probably one that's very relevant to many listeners here. As I had mentioned, originally PPP and ERC were mutually exclusive, but with the Consolidated Appropriations Act, that's no longer the case. You can take both. But that was only passed at the end of 2020, and really too late for any employers to do anything about it for 2020. So at this point, the general answer is yes. If you're an eligible employer and you meet the eligibility requirements for 2020, and they're slightly different than the requirements for 2021. But if that's the case, generally, yes, you can retroactively claim the ERC for 2020. That would be done through amending your quarterly 941, your payroll tax return. And if you have a payroll service provider, you would do that through them. But that potentially opens up potentially thousands of dollars in retroactive credits for 2020. And at Viventium, we are really just trying to get the word out there to as many of our clients as possible to make them aware of this opportunity so they can get their fair share of those retroactive credits.
Great, thank you, Malka. So once again, thank you for joining us today. We mean it from the bottom of our hearts when we say we hope to hear from you soon. We'll be sending you an email recapping much of what we covered in the webinar, and all of our contact information is included on this slide, which will also be included in the recap email. So I will give you a few minutes back. We ended a little bit early, but once again, thanks so much for joining.